I've been dealing with this for like over 8 years, and not a single doctor has been able to provide me the relief that you gave me today.
Wow.
And was able to walk out of the office without his cane. They just found me at the bottom of the mountain somehow, and I was sitting in a chair like by a lodge, and I looked like I've been drinking for like 8 hours straight.
And you don't remember
I don't
this.
remember any of this.
That is
No,
so scary.
it's-
Do you remember the wipeout?
No, I don't.
Whoa.
I don't. The only thing I remember of that day is like waking up, literally being so dizzy and my head ringing.
Welcome, everyone, to a new episode of the Expect Miracles podcast. We have a very special guest today, Dr. Ben Farca. He just started with us at Spine of Life Upper Cervical in St. Augustine. He has a phenomenal life story of how upper cervical chiropractic gave him his life back. So much so that that's why he does the upper cervical work today. We're going to jump into that, and we're excited to have him on the show. So without further ado, Ben, how are you today?
I'm doing great. Thank you so much for having me on the podcast.
Absolutely. So, Ben, where are you from originally?
I am originally from New York, Queens, New York.
Okay.
Yes. And then now I live in Long Island with my family up there. Yeah.
Cool. Well, now you live in St.
Well, now I live in
Augustine.
St. Augustine, yes, but my family moved out to Long Island a few years ago.
Yeah.
So.
And so was chiropractic something you were always into growing up, or is that something you found later on in life?
So I kind of found chiropractic when I was like 15, 16 years old. Like my entire family didn't know anything about chiropractic or anything like that. So I was actually, like I was saying, 15, 16 years old in bed one night, like watching YouTube like every other teenager, and ended up falling asleep and waking up in the middle of the night. And there was like, you know how YouTube has like that autoplay?
Yeah, yeah.
So it like played a chiropractic video, and I was like, what the heck is this? Like, I've never seen this before. And this guy walks in like using a cane, hunched over, everything like that. And the chiropractor kind of is explaining what he's doing to the patient and the viewers, and like ends up adjusting him. And this guy out of nowhere, and he's like this massive, like 200-pound dude,
Really?
like all muscle, starts like breaking down into tears.
Whoa.
And I'm like, did he just like murder this man? But I'm intrigued.
Yeah.
So I keep watching, and this guy's like, I've been dealing with this for like over 8 years, and not a single doctor has been able to provide me the relief that you gave me today.
Wow.
And was able to walk out of the office without his cane. So I said to myself, I don't know what he did, but I kind of want to learn a little bit more and like do that.
Yeah.
So like growing up, I always wanted to help people. I didn't know what that entailed, but I've always wanted to help people. Like I said, my family didn't know anything about chiropractic. So after I saw that video that next morning, I was like, Mom, Dad, do you know anything about chiropractic? And they're like, absolutely not.
Yeah.
But if you're interested, like look into it.
That's so cool.
So yeah, because I had like no passion growing up but playing video games
Really?
and playing hockey. So
Yeah.
I just really, that was like their first time where they were like, yeah, look into it and just see what happens.
Yeah.
And then I quickly realized that you needed to be good at science
Yeah.
and to do all those prerequisites in college to go to chiropractic school. So I
Yeah.
didn't do it.
Yeah, that's exactly. I psyched myself out with like the sciences and
Yeah.
the physics courses and everything, and I was like, I don't know if I can do that.
Yeah. So that was a big turnoff for me. So I ended up not doing it and pursuing business. So I went into like business communications, which is kind of like the, I don't know what I want to do with myself,
Right.
like majors
Yeah,
in college.
yeah.
And so going through that, and it was my senior year right after COVID hit in undergrad. And my girlfriend at the time was like, what do you want to do with yourself after school? And I was like, I have no idea, because what I'm doing right now is not really like fun. I don't have a passion for it, but I'm just doing it because that's
Right. You're
what
just
I've been studying.
Getting the degree,
just getting
yeah.
the degree.
Yeah.
So she asked me a question, which I'll never forget. She was like, if you had to do something for the rest of your life and money, time, schooling was not a thing, you started tomorrow, what would you want to do? And keep in mind, like throughout this entire like 15 to like 21 years old, I was still interested in chiropractic and watching like some
Yeah.
YouTube videos here and there. So I said, it took me some time to think about it, but I was like, I really want to be a chiropractor. And she's like, well, you're going to frickin' do that.
Hell yeah.
So literally that day, I called a chiropractic school and said, hey, I have zero prereqs or anything like that, and I want to go to chiropractic school. Where do I go? What do I do? Like, how do I start? So she sat on the phone with me for like an hour going over like all my classes that I took in undergrad, and was like, you actually have a bunch of credits that we can use as prereqs to come into the program. You just have to take these extra classes. So I was like, beautiful. That ended up being Palmer, Florida, because I wanted to be in Florida. And I called my parents after I had that plan set, and they were so happy. They were like, our son has a plan with himself. So after I did that, my parents were like, why don't you look into other schools as well? Even though I was already so set on going to Palmer, Florida, because, I mean, everything happened so, like, smooth with them.
Yeah.
But I called Life, which is where I ended up going to school, and I went to Life, and I spoke to a recruiter there, and Christy, if you're watching this, but she's an absolute legend, recruiting students of, like, the Northeast region.
Yeah, they flew you out, and
she was like, we want you here. Like, hop on this Zoom call. We'll answer any questions you want. There's a doctor that graduated from Life. There's a current student who's about to graduate. Just listen to what they have to say. Ask any questions about the program. And then if you come to the Zoom call, we'll fly you out for a weekend, and it's basically like a leadership, like, recruit weekend for, like, new students or prospective students. And I thought that she was just being nice, like, hey, it's just for you. It ends up being for every student.
But you felt special.
But I felt special. So I went, and that weekend, my life flipped around. I was like,
this is
I need to do this. Like, this is my calling. And immediate, like, switch of, like, mentality of, like, I never wanted to work hard in school. I just got by. I just wanted to hang out with friends, like, play video games, like, do sports and, like, whatever, and just not do schoolwork. And then as soon as I went there, I was like, I'm going to work my butt off to get through this program, so now I can be this like amazing chiropractor. At the time I was thinking that. And of course, upper cervical was not at all in that.
You didn't even know what it was.
I didn't even know what it was. I thought it was just the guy that I saw on YouTube,
Yeah.
and like some other people that come up on like TikTok
Yeah.
and whatever.
Well, so let's back up a little bit too. You had some crazy symptoms.
Oh yeah,
like
that
going
is true too.
on through all of this.
Yes.
Yeah. So how were you, like, when did those crazy symptoms start, and like
So-
what was going on?
I had a few concussions growing up, one playing basketball, one playing hockey, but then the worst one was in undergrad.
Okay.
In junior year, right before COVID hit, was when I went snowboarding, and the concussion that I had was so bad. I don't even remember the day. The only reason why I'm able to like tell pieces of a story is because my friends told me about it and like told me what happened. They didn't even see me wipe out. They just found me at the bottom of the mountain somehow, and I was sitting in a chair like by a lodge, and I looked like I've been drinking for like 8 hours straight.
And you don't remember?
I don't remember any of this.
That is
No,
so scary.
it's-
Do you remember the wipeout?
No, I don't.
Whoa.
I don't. The only thing I remember of that day is like waking up and literally being so dizzy and my head ringing. Like I couldn't hear anything but like these loud ringing noises in my ears.
That's scary.
And I blacked out again after that. I don't remember anything after that. So then they found me at the bottom of the mountain, and they're like, "You good?" And I was like, they told me, I said that I hit my head and I think I have a concussion. So they're like, "Oh crap, do you want to chill here?" And I was like, "Yeah, I think, but I don't really feel good." So they took me to like the on-site, like on the mountain, like medical like building. The guy like did a quick analysis of me and was like, "Yeah, he's got a really bad concussion," and he was like, "You need to take him to like the hospital to make sure, like get scans, make sure like everything's good on the inside, like there's no internal bleeding or like any fractures or anything." So
Did you have a helmet on?
I did have a helmet on,
Okay.
believe it or not.
Wow.
And I checked my helmet like a few days later after I realized what happened. Not a dent or a scrape on the helmet.
Really?
So I don't know if it was a bad helmet or what.
Yeah.
But like, anyways.
Yeah.
But the hospital, I don't remember that either.
Yeah.
The hospital, they said, yeah, he just has a bad concussion. Nothing's going on. And he'll be fine. Like, just let him know. Like, just rest. And the next day I woke up. I had no idea what happened. I had the worst headache of my life. I felt like absolute crap.
Holy shit.
And I texted my friends. I was like, "What the hell happened?" And they told me everything. And they were like, "Yeah, but the doctor said you just needed to rest." And I had my two friends come one of them who was with me snowboarding and another one who was kind of like taking care of me that day.
Yeah.
And they literally came over the next day and they were like, you are doing nothing. We're
Yeah.
taking your phone away. They said, don't look at your phones. They locked
Yeah.
me in my room like in the dark and they were like, you just need to chill and
Yeah.
relax. So I was like, okay. And then after like a week or so, I felt okay. But then like 2 months later, 3 months later, I started getting these wild symptoms I've never experienced before in my life. I was hit with like the craziest brain fog. Like I could not remember anything.
Yeah.
I had headaches. I was getting sick like once a month. I was like, I mean, besides the neck and low back pain, but like I was not sleeping right, like waking up multiple times throughout the night. I randomly, like every once in a while, started getting sleep paralysis, which that was so weird for me. And my friends were like, oh yeah, I got that once. And I'm like, I'm getting it like once a month, dude. Like something's off. And there were so many other symptoms. Like I was getting vertigo, like a little bit of dizziness and like ringing in my ears every once in a while. And it was just so weird. So I went and spoke to a doctor about everything. And he's like, yep, that's just post-concussion syndrome. Like there's nothing you can do. Like we already did the scans or already did everything. Everything came back clear. So it's kind of just going to have to live with it. So I was like, all right. And obviously gave me medicine to help me with like my headaches and pains and stuff, and I didn't really take too much because I grew up in a family that we didn't really take a lot of medication, which is a good thing, I guess. But anyways, I came to chiropractic school not even knowing that that's what they help with, and then I heard that through that life leadership weekend that they do, and they were like, we helped all these athletes, and like I think it was like Sidney Crosby came to our school, and like nobody hears this story, but he was like out for the count for a little bit.
Oh yeah.
And he got revived by chiropractic and functional neurology.
Yeah.
And was sent back out on the ice. Nobody talks about that story.
Yeah.
And was sent back out on the ice. Nobody talks about that story.
Yeah.
And he was at our school.
Yeah. That's crazy.
Yeah. So they were telling us about that and everything, and I was like, this sounds like it can really help me. So I started the program, was super psyched, making so many new friends. I get pulled into the clinic and I'm like, I'm ready for my life to be saved.
Yeah.
And at this point, I'm kind of used to everything.
Yeah.
And I'm getting adjusted and I'm getting worse. And I'm like,
he's getting worse.
I'm getting worse. And I'm like, what's going on? They just lied to my face. And and they were telling me like, I mean, it's a healing journey. Like sometimes it gets worse before it gets better. And I was like, okay. But 3 months, it was just significantly not changing and consistently getting worse.
Yeah.
So I was honestly for a little bit considering like, maybe this isn't like for me.
Yeah.
Like, how am I supposed to sell this?
Yeah.
Like, and sell chiropractic to other people when it's not even working for me.
Yeah.
So there was probably like a week or so where I was like, maybe I need to like take a step back, drop out of school. But I'm happy I didn't, because then one of my friends who's now graduated for like over 2 years came up to me, and he is an upper cervical guy.
Yeah.
And he practiced knee chest at the time. And he was like, can I look at your x-rays?
Yeah.
I was like, by all means, dude, like whatever you want to do.
Yeah.
And at the time, I think I was like third quarter or second quarter, because I've been in school for like 6 months at this point.
Yeah.
And he was like, dude, they've been adjusting you on the wrong side. I was like, oh, I don't really know what that means, but like whatever you think is right, like I'm down to try anything.
Yeah.
So we had a knee chest club on campus, and if you have your x-rays and your like thermography pattern scans and everything like set like, okay, this person's in pattern and he needs to be adjusted. If there's a doctor present, he can oversee and watch the adjustment if the student is over a certain quarter in the program.
Right.
And so he was like, let's get you adjusted. So I waited like a month for everything to like kind of like all the Titron scans and all my x-rays to come back like and everything like that, and for him to get the permission to do it.
Right.
And one day he's like, all right, guys, I'm going to demonstrate a knee chest adjustment. Ben, get on your knees and like put your head on this little table. And I'm like, okay.
Were you freaking out? Or
I was kind of like, I don't really know what's going on, but like I've been to the club, so like I kind of know what it is, but I've never experienced the adjustment. So I actually still have a video of this adjustment because it was so important to me afterwards, because I got the adjustment and I felt clunk. And I was like, well, I've never felt that before. And then I didn't necessarily feel different after that. But that night, I slept for 14 hours straight. It was the best sleep of my life. Every symptom I was experiencing before then, gone.
Wow.
Completely gone.
Wow.
I almost woke up and I was like, am I dead? Like, nothing's here. Like, I was in so much disbelief.
Yeah.
I texted him. I was like, I need to learn everything about this because I'm experiencing absolutely nothing that I was before. And he was like, I'm so happy to hear that. Like, I'll answer any questions you have. There's a student night at a doctor's office like 30 minutes away. At the end of the week, you should 100% come.
Yeah.
So I got that adjustment. Everything was great for like 2-3 days. And then I kind of went back to my old symptoms came back. And which was kind of normal for me because after I was getting adjusted, like normal chiropractic adjustments, like the next day, I was like, I need another 7 adjustments.
Right. But there was definitely a shift.
There was definitely a shift
after this one. Yeah.
I definitely felt a difference.
Yeah.
And so that's why I was intrigued. So I went to this student night and the doctor was so chill.
Yeah.
And he was like, dude, I'm so happy you had that experience. Let's take new x-rays on you and see if you're in pattern.
Yeah.
And maybe if you're in pattern, we'll get you adjusted.
Yeah.
So I was in pattern again and he adjusted me, and I don't do drugs. I don't drink. I don't drink coffee. I don't do anything to put me out of like my normal self. I was high as hell for 3 hours in his office resting.
Really?
In his resting room.
Like in a good way?
After the adjustment. In a good way. Dude.
Yeah.
I was just laying there like, smiling and laughing for 3 hours, dude.
Oh my God.
I felt so good. Slept another 12 hours that night, and I held that adjustment for 7 months.
Whoa.
7 months, I felt the best I've ever felt in my life. So immediately, I was like, I'm doing this.
Yeah.
This is where I was meant to be.
Yeah.
And this is what I meant to do. And I know so many people, like friends, family, that deal with similar things like that, that I can now like offer something different than the normal chiropractor out there and be a specialty. I was like, I need to get into this.
Yeah.
So I did knee chest for a little bit, and then I met Paul.
Yeah.
And then got into Blair. And then that just like took everything that I learned about upper cervical and just enhanced it by like 100%.
Yeah.
And then that's when I fell in love with Blair and upper cervical, and that's how I got to where I am today.
Nice. And you're just starting out as a new doctor. Yeah. You have that passion inside it because you know what it feels like to not be healthy. And there's so many people out there suffering with that. So that little piece of you can give to them. And I feel like that goes a long way with patients, knowing that your doctor or somebody that's trying to get you better has been there. That goes a long way as opposed, because you know what it's like to be told, oh, there's nothing wrong, go rest, you'll be better, or you're going to have to live with this forever. It's scary, and it's when you can meet somebody in the middle like that, like, I know how you're feeling, that's very powerful, and I feel like that helps out with the healing process too.
Absolutely. And I mean, we just had a patient come in for a few weeks, and she was experiencing similar stuff. And like sometimes it's not one adjustment, 2 adjustments. It can take a little bit of time to stabilize that area.
It took about 2.5 weeks.
Yeah. And to allow the body to really go into like the healing mode.
Yeah.
But I mean, throughout the few weeks that she's been here, I mean, it's been like consistent. Like I know exactly what, like how you're feeling, and saying like, this is a part of the process. You just have to trust us.
Yeah.
And trust yourself and your body, and that it knows what it's doing. And like, she got so much better and such good results, and she's leaving, and we're honestly kind of sad about it.
Yeah, she's been here for 3 weeks, and we're going to miss her. We saw her every day for 3 weeks.
Yeah, but it's when people don't know what to do and they experience upper cervical, it's life-changing.
Yeah. And dude, that patient we have from El Paso that's been here this week has been one of the craziest things I have ever, like, it's a true fucking miracle of what's happening to him.
This is a different patient, not the one that we were just talking about, but like,
this guy could not hear.
No.
He's completely deaf in his left ear and can barely, or his right ear, and can barely hear out of his left ear. He's dizzy, he's got vertigo, he's got tinnitus, and like 2 adjustments, the dizziness and vertigo is gone. And his brother came with him to translate because he doesn't speak English, and he would be right next to his left ear, and he could still barely hear him.
Yeah.
Yesterday, this guy comes in. He's face down on the table. His brother is standing like 6 feet away from the table and talking to him, and he's answering him.
Yeah.
And he can't even see his face because his face is face down on the table. He is hearing again. And everyone is just like, this is the most amazing.
You and I were like, what the heck is going on?
His hearing came back. He's not dizzy anymore. And it's just, it's one of the most, I've been doing this for 8 years now, and it's one of the most incredible things I've ever seen.
I mean, it's the most incredible thing I've seen, and I've been doing this
and it's just like
not that long.
You put the top bone in his neck back, and all of this stuff started to change. That is insane.
It's insane.
And crazy.
It's insane. The body knows exactly what it needs, and
Yeah.
when you restore proper nerve flow and blood flow back to the brain and the body allows everything to communicate with itself, your body will work wonders. And miracles happen. Expect miracles.
Expect miracles, baby. So, Ben, at the end of all my shows, I like to ask all my guests, what is one piece of advice that you have been given over the years that you would like to gift the audience? Could be absolutely anything.
Okay. So I'm gonna say this one. It's gonna be ever forward, never backwards. And my dad always told us, like my sister and I, this when we were younger, and to this day he's like, that's my motto, and he's gonna hear this and be like, hey, that's my motto. But yeah, ever forward, never backwards. You always want to strive to be greater than you were yesterday, and always enhance yourself as much as possible, and chiropractic is a great way to do that.
I love that. That's one of my favorite pieces of advice that I've heard on the Expect Miracles podcast.
Good.
Shout out to Mr. Farca. That's a great saying.
Let's go, Dad.
And Ben, where can I know you're still getting your socials and everything in order here, but if somebody wants to reach out for your story or possibly become a patient,
absolutely,
where can people find you?
So I am on Instagram at Ben_Farca, and I am on TikTok at ChiroBen1.
ChiroBen1. And you could also reach out to Spine of Life on Instagram and message us there, and Dr. Ben will see it there as well.
Absolutely.
So Ben, thanks for coming on.
Absolutely.
Dr. Ben's obviously going to be a reoccurring guest. We're having our other associate, Nicole King, on next week, and then we'll be doing some group episodes. So if there's anything you guys want to learn, conditions, how upper cervical works, leave them in the comments. Let us know, and we can do an episode on it.
Absolutely.
Everybody have a great day. Cheers, love. All right. We'll see you later.